Hi, I'm Dr. Brian Kaufman, and as the Chief Medical Officer and Executive Vice President of the CLL Society, I'm pleased to have this opportunity to speak to you on behalf of the CLL Society in regards to our role in the accredited continuing medical education program, Expert Perspectives on Incorporating BTK Inhibitors into Best Clinical Practices for CLL. For those of you who do not know, the CLL Society is a physician-curated, patient-centric nonprofit organization that focuses on providing support, education, and research that helps patients with CLL and related B-cell cancers. Because of the rapidly changing therapeutic landscape in CLL, education programs like this are crucial in helping to engage healthcare providers and patients, keeping them informed so that they can make the best decisions about care based on the latest research and best practices. Honestly, without AstraZeneca's support, programs like this would not be possible. We thank you for recognizing the importance of CME. These educational initiatives have a real and lasting effect on patients' lives. Importantly, from our perspective, this program provided an opportunity for the CLL Society to share information about our organization and to educate often difficult to reach clinicians who treat patients with CLL. Through the live in-person meetings and live webinars delivered via Plexus's network of oncology, hematology, oncology departments, the CLL Society was able to provide patient materials and resources and our informational brochures to over 600 hematology oncology providers in 30 different hospitals. We're able to reach over 1,000 oncology healthcare providers via the enduring online activities. We were able through this to help those clinicians better serve their patients by connecting them with us so they could take advantage of all our free resources and educational materials so that those patients could make their best decisions about their care in conjunction with their healthcare team. In addition, several of the CLL Society's medical advisory boards served as presenters for this program. The purpose of the program was to help clinicians formulate best practice treatment strategies by engaging in discussions about the evolving treatment paradigms and how they integrate into current guidelines. Participants had the opportunity to discuss expert recommendations for consideration when they're considering what treatment plans they should do for their next patient. The CLL Society is pleased to be a partner on this project and honored to be part of the AstraZeneca Spotlight Showcase. Thank you so much.
Good afternoon. On behalf of AVAHO, the Association of VA Hematologist Oncologists, and as Program Chair of the Expert Perspectives on Incorporating BTK Inhibitors into Best Practices for CLL Continuing Education Program, I would like to express our sincerest appreciation to all of the organizations that help to make this educational activity possible. The mission of AVAHO is to advocate for veterans diagnosed with cancer and hematologic disorders and to provide leadership in delivering quality, comprehensive care. One of the most effective resources that we use to accomplish our mission is the delivery of continuing education programs to our members. We recognize the impact that education has on improving the quality of cancer care to veterans. By providing evidence-based data, encouraging exchange of information, and facilitating networking between members, we help to broaden knowledge, encourage best practices that ultimately improve patient outcomes. As chair of this educational activity, my responsibilities included overseeing the development of the program content, as well as presenting several of the live in-person and live webinar activities. It was a pleasure to personally experience how these accredited activities support AVAHO's mission, as well as to witness the impact these types of programs can have on practicing clinicians and ultimately patient outcomes. As chief of the hematology oncology section at the Washington, D.C. Veterans Medical Center, I understand the importance of continuing education activities. Continuing education ensures that the oncology staff at the VA and DoD hospitals have access to much needed, relevant, and up-to-date clinical information on topics like CLL. These activities help to shape treatment decisions that our clinicians can best manage patient outcomes. We're thankful for these educational programs and appreciate the opportunity to advance the knowledge, competence, and practice of our clinicians. Thank you.
Hello, I'm Bruce Wright, a patient advisor and patient educator for the CLL Society and a retired commander in the United States Navy. I'm a disabled Vietnam vet, and in 2009 was informed by the VA that I had 2 cancers, chronic lymphocytic leukemia and prostate cancer. During the office visit, when I first received my diagnosis, my clinician told me to Google CLL to learn about it. As you can imagine, this was a very frightening and confusing message to receive from your clinician. Fortunately, I was encouraged by someone to join our local CLL support group. This group is where I really learned about my disease and how to be my own spokesperson and advocate when it comes to making decisions about my treatment strategy plans. Over the last 10 years, I've had to learn not only about the disease, but also how to navigate the Veterans Health Administration processes. I was pleased to learn that Plexus Communications was planning a patient education webinar for the CLL Society members, and I was happy to have been asked to moderate that program. The live patient webinar took place on September 3rd and was well attended by CLL patients and their caregivers. I am a CLL patient who is currently participating in the VA health system, and during this webinar, I was able to provide information about my CLL experience and offer guidance to other patients who are in various stages of treatment. Dr. Vino Gopal from Rush University in Chicago presented a very informative talk that provided some basic background information about the disease, and he also included very helpful information about incorporating BTK inhibitors into treatment regimens. The platform that was used for the webinar enabled participants to respond to polling questions that were incorporated in the presentation, as well as the ability to ask myself or the doctor questions. Patient education programs like this provide patients and their caregivers with the necessary tools and knowledge to have more informed decisions with their clinicians. Being informed can help patients to better navigate the often confusing and intimidating decisions they encounter throughout their treatment process. There are specific challenges in the VA where patients can benefit from programs like this, and I am passionate about sharing my knowledge with patients and their caregivers. I know I speak on behalf of the CLL Society when I express our gratitude to AstraZeneca and Plexus Communications for providing support and implementing this patient program.